Okay, time now for a look at the latest headlines trending in the health world. As always, we are joined by Dr. Syed Hussain of Trinity Health of New England. Good morning, doctor. Thanks so much for being here. Appreciate your time.
Likewise.
So this morning we are talking about how to protect yourself from those mosquitoes, especially now it's so muggy outside, so many of those. Got some on my ankles right now. Mosquitoes out in full force this summer. And they are posing some issues. So 12 mosquitoes have been identified in several shoreline communities, mostly in Fairfield County, to have tested positive for West Nile virus. So we have a breakdown here: 2 in Darien, 2 in Greenwich, and 1 case in New Canaan, 4 cases in New Haven, 1 in Norwalk, and 2 of them in Stamford. So Dr. Hussain, what is the danger that West Nile poses when it is transferred to humans? Right now, there are no human cases, thankfully, but what's the danger there?
Yeah, so usually most people recover. Angel, they don't develop severe symptoms. A very small segment of people that get infected with these mosquitoes with West Nile will come down with severe symptoms. So if you're having high fever, headaches, neck stiffness, nausea, vomiting, change in mentation, if you see someone, a loved one who's exhibiting those symptoms, they look confused, they're not their baseline, then that's when you need to seek help. Call their healthcare provider, seek help. There could be some blood tests that are done. Of course, the person needs to be examined, etc. Now, there is no treatment per se. It's supportive management for those people that do come down with West Nile. But I want to take a step back and how do we prevent that from happening in the first place, right? There's so many repellents out there. There's so many new things coming up. So viewers should keep in mind, you should look for EPA-endorsed mosquito repellents, those that contain a couple things that folks need to remember. DEET, that's diethyltoluamide, which is known, proven, safe, effective in terms of being a mosquito repellent. There's PMD. There's a couple others that folks need to look at, but look out for an EPA, Environmental Protection Agency approved mosquito repellent.
And where can you find that on the bottle?
So it should be at the back.
Okay.
There should be a label, but that's where folks need to look.
And as we talk about ways to avoid these mosquitoes, it seems impossible, but are they attracted to color maybe, stuff you're wearing?
Yeah, that's interesting. So there was a study published last year that showed that mosquitoes tend to get attracted to darker colors, black, for instance, red and orange. Why red and orange? Because that's apparently how our human skin looks to them. So they do get attracted to certain colors. But, it's the basics. Try to avoid areas where there might be mosquitoes. Stagnant water is a perfect breeding ground for mosquitoes, for instance. And wear longer clothing. I know it's not always easy during summer. It's hot, it's muggy. But use insect repellent, too. Avoid mosquito repellent around your mouth, your eyes, and make sure that when you're doing it for children, you follow the label indications.
And there's another theory out there that maybe your blood type can attract mosquitoes. Can you debunk that or confirm it?
Yeah, I'm probably going to debunk that. There's a lot of, there is research out there on this. Some studies say type O, but it's not really definitive.
Gotcha. Okay, so now that that's settled, let's move on to our next topic here. Something we keep hearing during this extreme heat. You got to stay hydrated, of course. Well, there is a new TikTok trend, and it's called sexy water. Yes, sexy water, trying to rebrand how people drink water. Now, sexy water is all about adding supplements to water to romanticize hydration. I thought drinking water was simple enough, but now we've got sexy water as well.
Right.
Is there a point to this? Is this actually beneficial?
So there's very little studies, very little research, Angelo, on this out there. So basics, again, for viewers to remember, stay hydrated. It's going to be a long, hot summer here and probably globally in most places. So drink water. 8 glasses or so is what it usually is recommended. Again, it depends on how active you are, what kind of environment you live in, if you have any underlying medical problems. So all of that factors into how much water intake you need. Listen to your body. If you're thirsty, you drink water. If your urine is colorless or light yellow, that means you're probably having adequate intake of water. But there, besides sodium, chloride, and potassium, there's really not a lot of research out there on all these other ingredients and supplements that folks, especially on TikTok, may actually be mentioning in terms of sexy water.
Is there anything you can add to the water? Maybe I know people add like powders, electrolytes. Does that stuff help?
Yeah, I mean it would, but not from a scientific perspective. The 3 ingredients that I mentioned would probably be the most important.
And as we deal with this crazy humidity and heat, you mentioned the recommendation. What's the guideline maybe people can follow every day to make sure they're getting that intake daily?
So by and large, again, there's a lot of things that go into how much water intake someone would need. Males, usually about 3.7 liters. Women, 2.7, a little lower. 8 glasses is what is usually recommended. Remember, you don't only have to drink water. There's water content in things, in fruits and vegetables. Watermelon, for instance, is a lot of water. So there's water that you can take from other sources. But try to avoid those carbonated drinks and things that may get you actually dehydrated. Caffeine. Try to stick to the old-fashioned, water.
Yeah, we don't need the sexy water. Just the regular water works.
Right.
All right, doctor, thank you so much for joining us
Thank
this
you,
morning. Really
Angelo.
appreciate it.